What is high blood pressure? High blood pressure, or hypertension, refers to blood pressure that is consistently higher than the standard normal level. For adults, normal blood pressure is below 120/80 mm of mercury. You may have hypertension if your systolic blood pressure, the first number in a blood pressure reading, is regularly above 130 mm of mercury, or if your diastolic blood pressure, the second number, is consistently above 80 mm of mercury. Around 47% of adults in the US have high blood pressure or are taking medication for high blood pressure. If left untreated, hypertension can increase your risk of a number of health complications over time, including heart disease and stroke. High blood pressure symptoms. People with high blood pressure typically don't experience any signs or symptoms. You can have hypertension for years without knowing. Most people find out they have high blood pressure after they get it measured, whether by a healthcare provider or through an at-home test. However, you can experience symptoms during a hypertensive crisis, which is when your blood pressure spikes to 180/120ths of a millimeter of mercury or over. Symptoms associated with a hypertensive crisis may include nosebleed, severe anxiety or a feeling of impending doom, shortness of breath, sudden headache, A hypertensive crisis is a medical emergency. Call emergency or go to the hospital immediately if you experience any of the symptoms above alongside a blood pressure reading of 180/120ths of a millimeter of mercury or more. What causes high blood pressure? Blood pressure measures the amount of force used to pump blood through your arteries. Systolic blood pressure measures that force at the moment your heart beats. Diastolic blood pressure measures the amount of force between beats. Over time, your systolic or diastolic blood pressure may go up if your heart has to work harder and use more force to pump blood to the rest of your body. Many genetic and lifestyle factors can contribute to the development of high blood pressure. For instance, having a family history of high blood pressure can increase your risk of having the condition. Other risk factors for developing high blood pressure include eating a diet very high in salt, not getting enough of certain minerals in your diet, such as magnesium and potassium, having anxiety and stress, having insomnia, lack of sleep, living a low-activity lifestyle, drinking alcohol excessively, being 55 years or older. How is high blood pressure diagnosed? A healthcare provider can diagnose you with high blood pressure by measuring your blood pressure levels. Typically, they will measure your levels by placing an inflatable cuff on your arm and using a gauge to measure your systolic and diastolic blood pressure, along with your pulse. Your provider may repeat the measurements several times in one visit or over the course of several visits to make sure that the readings are accurate. If you are at risk for developing hypertension, your healthcare provider may ask you to take your blood pressure regularly at home using a digital blood pressure monitor. Stages of high blood pressure. There are 4 stages of high blood pressure. Elevated blood pressure, (129 mm of mercury systolic and less than 80 mm of mercury diastolic. At this stage, you are likely to develop high blood pressure and should take steps to lower your blood pressure and prevent it from getting higher. Hypertension stage 1, 139 mm of mercury systolic and 80 to 89 mm of mercury diastolic. At this stage, your blood pressure is considered high and your healthcare provider may recommend lifestyle changes and possibly medication to lower your blood pressure. Hypertension stage 2, 140/90ths of a millimeter of mercury or higher. At this stage, your blood pressure is considered very high and your healthcare provider may recommend both lifestyle changes and medication to lower your blood pressure. Hypertensive crisis, 180/120ths of a millimeter of mercury or higher. This stage is considered a medical emergency and will require immediate care. Treatments for high blood pressure. If you have high blood pressure, your healthcare provider may recommend lifestyle modifications, medications, or both to lower and then manage your blood pressure. Certain lifestyle changes may help you manage high blood pressure and prevent related health complications, including avoiding sugary snacks and beverages and lowering your sodium intake to 2,300 mg a day or less, preferably 1,500 mg or less. Eating a diet rich in fruits, vegetables, low-fat dairy, whole grains, nuts, and legumes. Reducing your intake of saturated and trans fats. Limiting your intake of red meat and choosing leaner cuts when you do eat it. Keeping your alcohol intake within the recommended daily limit. 1 drink for women, 2 for men. Exercising at least 30 minutes, 5 days. Reducing your stress levels and seeking treatment for anxiety if needed. Talk to your healthcare provider about which of these changes are right for you. Together, you can create a plan to implement some of these modifications. Sometimes, lifestyle changes alone are not enough to effectively manage high blood pressure. In these cases, your healthcare provider may prescribe one of the following medications. Angiotensin converting enzyme (ACE) inhibitors, angiotensin II receptor blockers (ARBs), beta blockers, calcium channel blockers. If your healthcare provider prescribes medication to lower your blood pressure, it's important to follow the dosing instructions closely and to take the medication exactly as prescribed. Potential side effects vary by medication but may include dizziness, headache, rash, and fatigue. Talk to your provider if you experience any side effects. For many people, hypertension is preventable. Several of the same lifestyle changes used to lower high blood pressure can be used to prevent it in the first place. To prevent hypertension, you can exercise regularly, eat plenty of fruits and vegetables, eat foods high in protein, fiber, and potassium. Lower saturated fat intake. Limit alcohol intake. Related conditions for high blood pressure. High blood pressure typically doesn't cause problems right away. However, it can lead to a number of serious health complications over time. These include heart problems, heart attack, heart disease, angina, chest pain, and heart failure are some conditions you can develop. High blood pressure can damage the arteries and put added stress on the heart, which can impact blood flow to and from the heart. Stroke. High blood pressure can impact the supply of blood and oxygen to the brain. Vision loss. High blood pressure can impact blood vessels, including those in the eyes. Kidney disease and kidney failure. High blood pressure can damage the arteries around the kidneys, which can impact how well the kidneys can filter blood. Sexual problems. High blood pressure can reduce blood flow to the genitals, which could cause erectile dysfunction in men and low libido in women. High cholesterol. High blood pressure can damage the arteries and blood vessels, allowing low-density lipoprotein, LDL, cholesterol to build up in small tears of the arteries. Insulin resistance. High blood pressure is a risk factor for developing metabolic syndrome, also known as insulin resistance syndrome. Living with high blood pressure. Many people live with high blood pressure without knowing it, since the condition has almost no symptoms. However, when left untreated, high blood pressure can lead to several life-threatening conditions, such as heart disease and stroke, two leading causes of death in the US. Fortunately, high blood pressure is treatable. It's important to have your blood pressure checked by a healthcare provider regularly so you can be aware of your levels. If you have high blood pressure, you can also get an at-home test to check your blood pressure levels on your own. Hypertension can often be managed with lifestyle changes, such as eating a diet low in salt and getting 150 minutes of exercise. In some cases, your healthcare provider can also prescribe a medication to help lower and manage your blood pressure.